Snider, and I'm the owner of ACI Medicine. It's an integrated practice. We just moved back into Peoria the 1st of July, so this is our first seminar that we've done in the area in a long time. So by request, I was told that people wanted to hear about HRT. Well, it's a little redundant for me, but I was okay with that, because if that's what people need to hear about, then we'll talk about that. Okay, and I did a pretty heavy focus on testosterone on this. Okay, I did touch on the estrogens and progesterone too, but for time's sake, I don't want to keep everybody here and bore you to tears. So I had to focus on one area, and I think a lot of people have a lot of questions about testosterone. So that's where one of the things that I had decided to focus on. So again, this is the first segment of several in series on the seminars of what we're doing. The triads of symptoms, or systems rather, body systems. All of our systems of the bodies, all the organ systems, they all communicate in triangles. It's really bizarre, and you'll see what I'm talking about as I progress this. But again, this is the first of them. And it's kind of out of order, but hormone therapy, because that wasn't going to be the first one that I did, but out of request, that's what we're doing. So when I'm talking about the triads, the first one here, and I'm just going to show you what I'm talking about when I'm saying relationships of body systems. The brain, the immune system, and the gut, all one system, all one system. Allergies, arthritis, gastrointestinal disorders, constipation, nausea, diarrhea, all that stuff, bloating. Brain stuff goes along with it. Can't sleep, depressed, fatigued, those kinds of things. Focus. So, but that's another talk. So, but they're related. Adrenal, pancreatic, and thyroid. That's your metabolism. You got a problem with gaining weight around the belly region? That's the distribution of one of these areas. Insulin, cortisol, or we're dealing with something coming from the thyroid, usually conversion. Liver, lymph, and kidney, that's your detoxification system. So these are all your triads here. Cardiopulmonary, vascular, neurological. Systems that exist together. This is the one we're going to talk about. Progesterone, estradiol, testosterone. How they all have to be in unity and together. I'm not saying their values have to be equal. They have to be in sync and balanced. So does anyone know what a hormone is? Are there questions about what a hormone exactly is? Because that's pretty fundamental if we talk about hormones. What exactly are they? Because there's a lot of stigma. Well, it's a steroid hormone, so therefore, it's bad for you, right? Causes problems, right? Cancers and stuff like that, right? These hormones are in our bodies. These messengers, these communicators, they're in our bodies to deliver messages to organs. Right? That's what they do. Some of them here, as I had pointed out, some are steroids, some are proteins. Steroids are made of cholesterol. Vitamin D is a steroid. Some of them are made directly that go to cells and have their activity, and some of those messengers go to other organs and allow them to produce other hormones. So it's a pretty neat system that we have. A lot of balance has to take place, and there's a lot of understanding about each and every one of them. So it's not just one hormone that's going to do, fix you. Not necessarily. They convert to other ones too. Very important, and you'll see. This is kind of busy slide, but I think what's important here is what I just had talked about, how everything is in balance and interrelates. The top up there is those are values up there that, if you were to replace that hormone, or if you were to add that in, what effect would it have on another one? And that's over to the left. So, for instance, if you add melatonin into a body, what does it do? It stimulates growth hormone. DHEA does the same thing. We raise growth hormone by 25%. But you always have to be conscious about what you're doing when you add a hormone in. You put one in there, affect another one. Got to know which ones you're looking at. It's very important when you start dealing with this stuff. Steroids, as I said, they have a cholesterol backbone. I put estradiol up there because I want you to kind of take a note on the little OH group that's down in the left-hand corner of that. Because when we get to, you see the subtle differences in this molecular structure of these. This is important to know because of the conversions, right? But look when we get to testosterone. Look how close it is to estradiol. You got a double bond oxygen, and you're missing a hydrogen. The smallest thing on the planet. That's what makes a woman and a man different in hormones. Vastly different. But talking about one little hydrogen group, that's it, down there in the corner. Cortisol, they all convert and go down to cortisol. And you can see the structure again. You see the 4 carbon chains that I'm talking about? Those structures are all this. That's very significant when we're talking about a steroid, and that's where it comes from. LDL, your bad cholesterol. It's not so bad. Take a statin, wipe it out, wipe out your steroids. Not a good idea. Not if it's compensatory. So I underlined on that progest because really when we look at the names of these, progesterone, what does it do? Well, it promotes, gestation, pregnancy, helps. Right? For females, it's important, right? If you're going to carry a baby and you're low in progesterone, which you start losing it in your 20s, you're going to have some problems hanging on to that, miscarriages and stuff like that. Testosterone deficiency is our focus right here. But you have to consider estrogen excess. It may not be testosterone deficiency. It may be there's too much estrogen. So they produce the same thing. How do you know? Got to look at both of them. In traditional medicine, they look at the total testosterone and say, it's good. You're fine. That's one piece. You don't know if you're fine or not. You got to look at the whole picture. It's all balance. Physical symptoms, this is the stuff we're going to run through right quick here on the slide there. Write down the list on it. I got this guy here. He's a pretty good representation. When it starts to happen. It's got some complaints. Says, this is what's going on with me, Doc. I don't know. Doc says, it's in your head. You're fine. You're good. No problem. Moody. Can't sleep. Got some ringing in my ears. I'm tired all the time. Tired all the time. That's the most common thing we hear. I'm tired all the time. Hear it from men and women. Hot flashes. Yeah, guys have them. They don't know what it is. They say, I just wake up at night and I'm sweating. I don't know. Get hot. Get hot at night. Got to have a fan on me. Can't have a hot flash, brother. Kyphosis refers to the spine. There's our chiropractor there. He can tell you more about kyphosis. Get that kind of a hump in your back. Significant with testosterone. Hair recession, memory loss, fine wrinkles. That's a very significant finding in females. Decreased beard growth or leg growth or body growth. And the hair on your body, starts to diminish. Weak muscle. Growing a little extra tissue in your breast area. Slow, weak heart rate. Digestive issues. Yeah, it's linked. Get a belly. Erectile dysfunction. Small stuff there. Prosthetic disease. Yeah, joints. Numbness and tingling. Loss of body hair, and I put that on there so it's whatever. Missing foot, but as you see, not really. I just did a bad job on that part of the slide. And then the physical signs for females. These complaints a female has, right? Yeah, poor lady. Loss of height, low libido, pale, depression. Pale always shows up. It's just one of those things. It's kind of a pale look, not a good look to the skin. Small eye wrinkles, fatigue, memory loss. Fine wrinkles, they're always on the upper lip. That could be an estrogen deficiency too, though, in females. Also kyphosis, slumped over, fatty breast, weak muscle, flabby in the arms. That's a big one. Hold the arm up. Got this extra stuff here. Very significant for testosterone deficiency. Belly, loss of body hair. Yeah, you got large patches of body hair that are present. It's kind of a unique to testosterone deficiency females. Bruising. Again, they start to have small stuff too. Not so much in the breast area. You develop a little more fatty there, but in other areas, cellulite, dry skin. Can't see them, but you do get some varicose veins too with the circulatory problems. Mental signs for males. When we're talking about behavioral, when the nervousness and irritability is kind of a It's like a subtle internal thing, you know, where it's just something doesn't feel right. You know, feel like something's wrong. Can't put your finger on it, you know. And it does kind of irritate you. Little things bother you they didn't used to, you know, trivial things. So, nervousness too. Poor memory, concentration decline. There are some mixed evidence, you know, there's some mixed evidence and studies on cognition, on your ability to focus and think. Some studies show testosterone has an impact, some say it doesn't at all. So, you know, I don't know if it does, I'm not sure. I can't find enough to go one way or another. So they say it's possible. Don't know for sure. But you do have decreased motivation and interest, that's for sure. Absolutely. All the time. Confidence and it's the hormone of decisiveness. If you want to give testosterone a title, that's what it is. It's your ability to make a decision when you know it's the right decision and feeling very good about it. You know, I know it sounds, you know, kind of like, you know, how do you quantify that? How do you measure it? It's hard. But somebody who's having testosterone deficiency can tell you. Do you have trouble with decisions? Don't think so. Depressed mood, and then we see the stress, and stress is a big one, you know, because it makes the matters worse, and then you just kind of get in this cycle, you know. Can't sleep, I don't feel good, something's wrong with me, you know, I don't feel motivated, I don't have my endurance I used to, and it just gets worse, you know. More you stress, more cortisol goes up, worse it is. And then for female, same thing, same exact stuff. You know, as far as mental, we're talking all mental stuff here. So the reason I brought up mental and separated it out is because the two areas where testosterone has its most work is number one in the heart and secondly in the brain. So not what everybody thinks, you know, where it's, you know, the hormone of sexual function, you know, not necessarily. It has its first activity in the heart, keeping the heart beating and regulating, dilating blood vessels, that sort of thing. These are the most common complaints. I just put the top ones of what people, this is what we hear, you know, with the main ones being back pain and fatigue. Everybody who has testosterone deficiency has some degree of diffuse back pain that you can't put your finger on it. The chiro can't figure it out. I don't know, your back's tight, kind of hurts. Yeah, well, it's tender here, you got to get an adjustment, you know, but everybody complains. 75%, or there's an increase of 75% of people who are more likely to take something for pain control when they're testosterone deficient as opposed to those who aren't. That's significant, and that's in studies. That's been shown by one of the pharmaceutical testosterone companies, but it's still there in the evidence. Same with females, weight gain and fatigue. Those are the top two. You know, that's what we see a lot of. You know, those are the complaints. You see that with a lot of different hormone deficiencies, though, not just this. You know, in a lot of different body problems with body systems, which is why you have to have the whole picture. And then I put the other complaints that you do see on there. You know, and you can read some of those. You know, where I did point out, you know, digestive issues and stuff like that. Fatigue with exercise, instead of feeling better, feel worse. No pump anymore, just kind of blah when you get done training. You know, you don't have that hard feeling. You guys all know what I'm talking about. For female deficiency, I think the main thing on remember with that one again is that fatigue. You know, that lack of endurance and lack of motivation. That's big. Causes. I don't get too much into causes. I just want you to know there's a lot of them. You know, in a female, the top one is at the bottom, birth control. You know, and you see either too high or too low levels after birth control. So and it has to be balanced out. Birth control can be pretty nasty. There are a lot of others, though. I think for males, you know, we see a lot of guys that have sleep apnea and they just kind of blow it off. I snore a little bit, can't lay on my back, you know, wife kicks me, you know. But, you know, that's a pretty big deal because you rob your hormone production when your oxygen is gone. And when you quit breathing, you're going to see decline in a lot of different hormones that come from the brain. And one of them does control testosterone. Excessive running, I don't know if you saw that on there too. Excessive running lowers testosterone. So does weight training. You think you'd get, you know, positive results and be rewarded for your work. It doesn't work that way. The other way, goes down. So even more important if you're training to have your levels, monitored and checked. And say, well, I don't want to take anything. You're going and doing all that training, you're going to be low. It's going to drop. Vasectomy. Anybody has vasectomy, going to drop testosterone. They don't tell you that, but within 9 years, you're going to have some symptoms. Because you will drop, sometimes up to 25%. The lower you are before the vasectomy, the more significant that you're going to have with the symptoms. That's a busy slide too. Not going to get too much into it. I just wanted to show you that there are so many pathways that testosterone can take. And I put them all on there in order. With the first one being that when you run into enzymes through the skin, this is important when you're talking about topical gels and stuff like that, and why some of these testosterone companies, they don't tell you, if you rub that on a hair follicle, you're going to convert it to something else. It's going to go to DHT, going to enlarge your prostate, if not monitored. 100% of the time, if a gel is given or a cream on the skin, it will raise DHT and lower testosterone, if not dealt with. That's why you have to look at the enzymes and have those dealt with. The aromatase, it comes from fat tissue, converts testosterone to estrogen within 12 minutes of hitting in the bloodstream. Testosterone goes in, boom, estrogen turns it into it within 12 minutes. So if not monitored, put testosterone in, you're going to have estradiol rise with it. Estrogens rise with it proportionately if not dealt with. The cell is obviously the one in the middle. That's where you want transcription. That's your goal. You have to have DHT to have testosterone get there and work. And it can't be competing with estradiol at the same spot. It has to get to the cell and do the job. Seems like it's there is a very small chance that this would even happen, It seems unlikely, especially when you consider the last one on there, which is SHBG. 95% of your testosterone is bound to that protein. It does nothing. The more stress you have, the higher that protein goes. Yeah, sometimes double, sometimes triple. Our LA clients, 4 times elevation compared to our Midwest clients. Why? Multifactored. But if you have stressors, internal or external stressors, SHBG will go up. And if not dealt with, you'll have less than 5% of your testosterone available at all times. SHBG is very important, though. It has a function of protecting your hormones from being used up all at once. Okay, so we have to have it, but it needs to be balanced. Incidentally, the naturopathic treatments for it, wild oats, quercetin nettles, what else? And then in our pharmaceutical world, we compound, what's danazol, which is in the same class as another one called stanazol, commonly known as Winstrol. You put it underneath the tongue, bypass the liver, drops the binding protein, predictably within 4 months on the dosages, if you know what you're doing, with the dosages down in 4 months from, say, a level of 40 in a guy down to 17 where it should be in 4 months. They're very effective. You can do it with quercetin nettles and wild oats very aggressively, but you have to be very aggressive on the therapy, how much, and it does take up to 8 months. So that's SHBG is stubborn. Other things that make it go up, toxins, birth control, okay? Birth control in a female, it'll raise it up 5 times, 6 times. It'll stay that way for years if not dealt with. So why you took birth control, 20 years ago, doesn't matter. It's still gonna be a problem. The pathway, this is a different path. This is an adrenal pathway. As if I didn't confuse you enough, I showed you how testosterone converts once in the blood and how the brain in a male produces 2 hormones. They go down and make sperm and they make testosterone. And then once in the blood, that's where you have your enzymatic changes that I showed you. Now this is in the adrenal gland, because the adrenals make DHEA, which is a precursor to testosterone. So there's more than one, and this is the females, mostly how they get their testosterone is going to be through their adrenals. So if a woman is stressed out, cortisol goes up, so does DHEA. What do you think happens to the testosterone? Yeah, right. Elevated into superphysiologic range. It shouldn't be that high. What are the complaints then a woman will have? Hot flashes, this stuff from low estrogen. Can't think straight, can't remember anything, irritability, acne, weight gain. So it's important to know the adrenal stress has an impact on the hormones big time. That's what the point of this is. So that's why you need to look at everything, not just one. It's so funny. A guy goes, well, I want to get my testosterone checked. Okay, check the testosterone. Look at it and go, hey, testosterone's okay. But you only looked at that. What are you going to know from that? It's like taking one piece of a puzzle and going, I know what it is. I know what that picture is. You don't know anything. You just looked at one piece, and you looked at the total. Didn't even look at SHBG. Didn't look at free levels. Didn't look at estradiol. Didn't look at DHT. Didn't look at cortisol. Didn't, all the impacting things that happen, whether that testosterone is going to be successfully getting to the cell and have its activity. It's dependent on several things happening, everything aligning right, working correctly. These are serious things, some serious things that happen with low testosterone. So, well, if you take that, you're a bad person and it's going to kill you. Now, if you're low and you don't take it, you got an increased risk for heart attack. So, yeah, a lot of people have heart attacks, right? Some of them don't make it. So I don't understand the logic in how that hormone that's supposed to protect you, and I already told you has its most work in the heart, how it's put there to cause you to have a heart attack. Not so. It's prevention of a heart attack. Diabetes, obesity, blood pressure, all those things, they're all impacted negative-wise with testosterone deficiency. So it's chronic health issues, breaking bones. Testosterone makes your bones strong, not just the muscles. And dementia, isn't that? You have the genes for dementia. You're more likely or more apt to have problems with that gene being expressed. So with testosterone deficiency. Estradiol, as I showed you the structure of it earlier, the physical signs, I kind of went through these a little less, not as much, but I did cover some of them. And started with female. But again, you got to remember though what I just said about testosterone excess. A stressed female will have symptoms of estradiol deficiency, but doesn't need. Woman goes inside, I'm having hot flashes, I can't sleep. All right, you're perimenopause. Here's an estradiol patch. And wait a minute, you're stressed out and your testosterone's high, and the estradiol is perfect. It wasn't the right therapy. Just making an imbalance worse. You're raising both of them up too high. So that's why, again, looking at everything. The common deficiencies and complaints of estradiol deficiency, the ones with the stars there, both. It's both sexes there. The big one for a guy is the words right here, and it never makes it to the tongue. Or the dryness to the eyes is horrible. It feels like there's sand in your eyes. So if someone's tampering around with testosterone on their own, and they're taking a bunch of estrogen inhibitors, and they think they're doing their bodies some good, and then they're weakening their bones, and you actually weaken your muscles along with too much aromatase inhibitor. Too much lowering estrogen, and you lose muscle. That's correct. And bone. So it's important. It has to be there to help promote muscle growth. Joint pains, aches like no tomorrow, whether too high or too low on estradiol. Wrist and elbows. That's a common complaint. A woman that gets estrogen deficient, right? She ends up with a bag of predictable meds. Antidepressants, stuff for your bones, stuff to help you sleep, Lady's bag gets bigger and bigger, right? As she goes on through. Women are so mistreated. All she needs is some balance in her hormones and all is well. You're not missing an antidepressant in your brain. You're missing hormones that promote you to make those chemicals. See? Wrong treatment. Causes the deficiency of estradiol. I just listed a few of them. I think again when I mentioned vasectomy for males and testosterone, tubules or any kind of invasive surgery where you're talking about the female organs, you're going to affect the ovaries. That could be a problem then. Long-term consequences with estradiol deficiency. I think that, there's been some studies of people saying, well, I'm afraid of estrogens because it causes cancer. And actually, the WHI study, the big study that people were referring to, was use of a synthetic estrogen, and it was in a pill. Those are night and day different from a cream. But what was important is that they did find that it did reduce colon cancer. So there was protection there, and obviously osteoporosis, because it does. If your estrogen is too low, you lose bone because there's nothing to stop it from getting chewed up. Heart disease too. Cholesterol imbalances, that's another predictable med a woman will get if her hormones are out of whack, and as she ages, well, here you need something for your cholesterol now, and your blood pressure eventually. Physical signs and common complaints of progesterone. Now this is for the female. I think the big one is the main one anywhere. It's this kind of depressive, anxiety, can't sleep business, because it does promote you to make more serotonin and GABA. That's in a guy too. 2 chemicals in your brain that you need to relax you and help you sleep. Okay, very important for those. Common complaints and I put this progesterone or estrogen excess, because again, if estrogen's too high, then you're going to see deficiencies of other hormones, progesterone being one of them. This is what you see, some of the problems: headaches, depression, can't sleep, anxiety, those kinds of things, rage and anger. So the estrogens get blamed a lot for the problems, but progesterone could be the issue, or testosterone could be the issue, and that's in both sexes. That's everybody. Big one in the cancer risk is huge, but I think with progesterone this can't be looked at as a hormone that has no power. This is pretty cool. There was a guy that had a stroke a few years ago, and I took some literature up from a big study called the PROTECT study, where progesterone was looked at as somebody who had a stroke or a head injury to reduce inflammation by giving high dosages of progesterone early on. And the quicker you put that in there, the less the deficit was in the outcome. Great study, and I took that up there, gave it to the residents at the hospital, and a handful of progesterone for the guy that had the stroke. And I said, here's the studies, and I just left it there. And they ended up giving it to the attending, and they used it. They used it on the guy. I put enough evidence there, not just that study, put others in there. And it was compelling enough to where they went ahead and used it, which I thought was a big deal, But it's a very important hormone reducing inflammation in the brain. I put the various, female imbalances, and I think when I run through, I'm just going to kind of go quickly because I want you to see this really. When you have elevated estrogens, you could have, if your testosterone, progesterone good, then you have elevated estrogen. But you know what I mean? Where one and the other is up or down, they all can produce different symptoms that all look like you're going to blame the wrong guy. So, various combinations of them. You see there's a lot of symptoms with variances in these hormone imbalances. And that's really what I wanted to show there. Not that you have to get all busy with this, but if people do study the slides, then they'll see what I'm talking about there. These are we're wrapping it up here, but this is common mistakes seen in clinical application, okay? In other words, when you go to your primary care doctor, or you go to somebody that's dabbling around with a little bit of hormones, just getting started, they don't know a whole lot, haven't been doing it for, a decade, whatnot. Failure to recognize the conversions. I just showed you the conversions, how one hormone can become another one. Unrecognizing the root causes, because there's a lot of things that could cause you to be imbalanced, and if you don't look for those, you're not ever going to fix the problem. You can Band-Aid it, and I think some of the big ones are the biggest real complaints that I have about the way people are treated in integrative medicine is the not spending enough time with people. It takes a long time to get to the root. It really does. And providers that are trapped in an insurance model, they see a patient for an average of 7 minutes. That's what you get with your primary care. Who accepts your insurance? 7 minutes. Can't do any of this with that. You forget it. So there's the body systems, and again on all those interrelationships and how they all, one affects the other one in the circles there. So detoxification, circulatory, metabolism. You have to have a lot of times multiple panels done to get to the root. Okay, it's not just as simple as looking at your testosterone level or looking at your estrogen or progesterone level. It's not that simple. A lot of things influence it. I don't know why I threw that up there, but anyway, those are, from the integrated standpoint, most important supplements you have when you train. And it should be no surprise. There's nothing fancy about them. Gerald could talk more about that, but that's one of the reasons I put that up there, because we have Magnum here with some of the here to educate you a little bit about some of the subs. Good branched chain aminos, you're never going to get enough of it from your food. If you're training hard, can't do it, you're going to have to supplement it. Your glutamine, not only for gut health, keeps you from having some inflammatory problems, but it's the most abundant amino that we have. So important to replenish that as well. Arginine, keeping your blood vessels dilated, keep your heart ticker and all that stuff working. It lowers inflammation. When you raise nitric oxide, you reduce CRP. That's inflammation. They're yin and yang. Okay. A good multi. Everybody probably ought to have a good multi. Good multi is usually a handful. It's not one Centrum that you can throw through the wall. It's a handful of them. And if they're in your stool when you get done going, that's where your money's going to. So invest in a good one, and usually they're capsulated. Okay, there might be some some of the mineral tabs and such might be a little bit more in the pressed pill form, but generally speaking, you're going to have a handful. And there better be a couple of them that you can squeeze, and they're little gels too. Okay, Gerald again can talk to you a little bit more about that. In a packed probiotic, when I say packed probiotic, I mean one that has a lot of different strains, okay? Not just acidophilus, okay? You got pay attention to what you're getting. Pharmaceutical grade, good probiotic with a lot of different strains. The reason I'm stressing that, and this is a whole nother talk, but it's each and every one of those organisms that's in your body, in your lungs, in your gut, natural flora that's there, all have an impact on your genes. Cholesterol, heart disease, Alzheimer's, regulating your genes, diabetes, weight gain, all of them. Those bugs need to be in balance. So a good probiotic, most people have not enough of the good probiotics in their bodies when we test them. It's just general. People need it. So it's a good anti-aging tip anyway, no matter what.